Welcome to Health 365 Day, where we bring you medical insights that can protect your health and even save your life. I'm Dr. Mark Turner, and today we're re-diving into a critical topic: 13 early signs of kidney failure that you absolutely cannot afford to ignore. Your kidneys are silent heroes, filtering nearly 50 gallons of blood every single day, removing toxins, balancing fluids, and regulating vital functions. But here's the terrifying truth. Kidney failure can creep up quietly, with symptoms so subtle that most people mistake them for normal aging or everyday stress. That's why today's video is so important. We'll uncover the 13 critical warning signs that your kidneys may be in distress, signs you must recognize early to protect your health. Now, let's start counting down these early warning signs, beginning with one of the most common, yet most overlooked. Sign 1. Fatigue and weakness. Imagine this: you've had a full night's sleep, yet you wake up feeling like you barely rested. You find yourself reaching for your third cup of coffee before noon, wondering why simple tasks feel exhausting. This isn't just tiredness. This could be your kidneys quietly signaling distress. Here's why. Healthy kidneys produce a hormone called erythropoietin, EPO, which tells your bone marrow to make red blood cells. These cells carry oxygen throughout your body. When kidneys start failing, EPO production drops, leading to anemia, condition that starves your muscles and brain of oxygen. Research published in the American Journal of Kidney Diseases shows that up to 60% of people with chronic kidney disease suffer from anemia, resulting in persistent fatigue, weakness, and low energy levels. Many people dismiss this as aging or stress, but it's often an early warning sign that kidney function is declining. Sign 2. Swelling in feet and ankles. You notice your shoes feel tighter than usual, or your socks leave deep marks around your ankles. While this might seem like a minor issue or the result of standing too long, persistent swelling can signal kidney trouble. Healthy kidneys maintain proper fluid balance by filtering out excess sodium and water. When they fail, fluid begins to accumulate in your tissues, a condition known as edema. Gravity pulls this fluid downward, causing noticeable swelling in your feet and ankles. What makes kidney-related swelling different from temporary puffiness caused by salty foods? It doesn't go away easily, and over time, it can spread to your legs, hands, and even your face. Ignoring this sign allows kidney damage to progress silently. Sign 3. Changes in urination. Your urine is like a daily health report card, especially for your kidneys. Subtle changes can be some of the earliest clues of trouble. 1. Red flag. Foamy or bubbly urine, a sign that protein, which should remain in your bloodstream, is leaking into your urine. According to the Clinical Journal of the American Society of Nephrology, this condition, known as proteinuria, is one of the earliest indicators of kidney damage. Other warning signs include frequent nighttime urination, nocturia, suggesting kidneys are struggling to concentrate urine; dark, cola-colored, or pink-tinged urine, possible sign of blood in the urine, which needs immediate medical evaluation; sudden changes in volume, either urinating much more or much less than normal, can indicate declining function. These changes should never be ignored, especially if they persist. Sign 4. Shortness of breath. You climb a flight of stairs you've tackled hundreds of times before, but suddenly you find yourself gasping for air. While your first thought might be heart or lung problems, your kidneys could actually be the hidden culprit. There are two main reasons kidney failure causes shortness of breath. 1. Anemia. Fewer red blood cells mean less oxygen is delivered to your muscles and organs, making simple activities feel like a workout. 2. Fluid buildup. When kidneys can't remove excess fluid, it can accumulate in your lungs, causing pulmonary edema. This makes breathing feel like you're trying to inhale through water. A major study published in the American Journal of Kidney Diseases found shortness of breath to be one of the most commonly reported symptoms among patients with declining kidney function. Sign 5. Nausea and vomiting. Persistent nausea, a sudden loss of appetite, or an aversion to foods you once loved, could mean your body is being poisoned from within. When kidneys fail to properly filter waste products, toxins build up in your blood, creating a condition called uremia. According to the National Institute of Diabetes and Digestive and Kidney Diseases, uremic toxins irritate your stomach lining and affect your brain's appetite centers, causing waves of nausea, vomiting, and a growing disinterest in eating. This isn't about having an upset stomach from bad food. This is your body's reaction to toxins that should have been filtered out by healthy kidneys. Sign 6. Persistent itching. Imagine an itch so deep that no amount of scratching brings relief. This isn't ordinary dry skin or an allergic reaction. It is a whole body torment linked to kidney disease. Research published in Clinical Nephrology reveals that up to 90% of patients with advanced kidney disease experience severe itching, often caused by a buildup of phosphorus and other toxins in the blood. These substances irritate nerve endings beneath the skin and even lead to deposits of calcium phosphorus crystals, intensifying the discomfort. Traditional anti-itch creams rarely work because the problem isn't skin deep, it's in your blood chemistry. Sign 7. Metallic taste. In the mouth, food suddenly tastes like pennies or metal shavings, and eating becomes a chore rather than a pleasure. This unpleasant metallic taste often comes with bad breath that smells faintly of ammonia. According to the National Institute of Diabetes and Digestive and Kidney Diseases, this occurs because waste products, especially uremic toxins, are circulating in your blood, affecting both your taste buds and sense of smell. As appetite drops, nutritional intake suffers, leading to unintended weight loss and muscle wasting, a dangerous situation for anyone, but especially for those with kidney disease. Sign 8. Muscle cramps. You're sleeping peacefully when suddenly a sharp, excruciating pain shoots through your calf or foot. Muscle cramps like these can be severe enough to wake you up in the middle of the night. While occasional cramps can be due to dehydration or overexertion, frequent or severe cramps may indicate kidney dysfunction. Healthy kidneys regulate vital electrolytes sodium, potassium, calcium, and magnesium that control muscle contraction. When kidney function declines, these electrolyte levels become imbalanced. Research in Kidney International reports highlights that low calcium and high phosphorus can trigger painful cramps, while dangerously high potassium can cause irregular heart rhythms and, in severe cases, cardiac arrest. If cramps are happening regularly, even without exercise, it's time to pay attention to your kidney health. Sign 9. Poor concentration or brain fog. Ever walked into a room and forgotten why you went there? Or found yourself reading the same sentence 3 times because it just wouldn't stick? While occasional forgetfulness is normal, persistent brain fog could be a sign of kidney trouble. When kidneys fail, toxins accumulate in the bloodstream and can cross the blood-brain barrier, affecting brain function. This can lead to a condition known as uremic encephalopathy, which impacts memory, focus, and cognitive processing. Studies in the American Journal of Nephrology show that even mild kidney disease can cause noticeable declines in cognitive performance. Left unchecked, this cognitive fog can worsen, affecting daily life and increasing risks of accidents or poor decisions. Sign 10. Puffiness around the eyes. You wake up and notice swelling or puffiness around your eyes, as if you hadn't slept well or had been crying. While allergies or lack of sleep may be the obvious suspects, persistent puffiness, especially in the morning, can be an early sign of kidney disease. Why? Because this area has very delicate skin and small blood vessels, making it one of the first places to show signs of fluid imbalance. Kidney dysfunction often leads to protein leakage, proteinuria, where essential proteins like albumin are lost in urine. Since these proteins help maintain fluid balance in your bloodstream, their loss allows fluid to escape into surrounding tissues, causing puffiness. Sign 11. High blood pressure. You check your blood pressure and notice it's creeping up despite taking medication or maintaining a healthy lifestyle. This is a red flag because kidneys and blood pressure are deeply interconnected. Healthy kidneys regulate blood pressure through controlling fluid balance, removing excess fluid from the body, producing hormones like renin, which help regulate blood vessel tension, managing sodium and potassium levels, key minerals that affect blood pressure. When kidney function declines, these regulatory processes falter. Excess sodium and fluid build up in your blood, increasing pressure inside your vessels. Worse, damaged kidneys may produce too much renin, causing blood vessels to constrict even more. Research in the journal Hypertension shows that uncontrolled blood pressure both damages the kidneys further and accelerates the progression of kidney disease, creating a dangerous cycle. Sign 12. Dry and flaky skin. Persistent dryness, itchiness, or flaking even with proper hydration and skincare can signal deeper internal issues. Your skin is an outward reflection of your internal health, and failing kidneys can create imbalances that affect skin quality. When kidney function declines, phosphorus levels rise, leading to calcium phosphorus deposits in tissues. Vitamin D production drops, affecting skin and bone health. B vitamin deficiencies, common in kidney disease, impact skin repair and elasticity. Research in the International Journal of Dermatology confirms that chronic kidney disease is closely associated with skin changes, sometimes appearing long before other symptoms are noticed. Sin 13. Loss of appetite and unexplained weight loss. Imagine sitting down to a favorite meal and feeling no desire to take a single bite, or finding yourself losing weight without trying. While some might see weight loss as a positive, when it's linked to kidney problems, it's a warning sign of serious internal imbalance. This occurs because uremic toxins interfere with the body's appetite-regulating hormones, like ghrelin, while increasing inflammatory substances that suppress hunger. Over time, this can lead to malnutrition, muscle wasting, and severe weakness. A study in nutrition in clinical practice found that poor appetite and unintentional weight loss often signal advanced kidney dysfunction and are linked to worse outcomes if left untreated.